Welcome, everyone, to SAP and Intel's Thought Leader Showcase Series. Today, we'll be featuring DXC Technology's Healthcare Workforce Solution. The title is Managing the Wellbeing of the Healthcare Workforce. Certainly a topic that is very timely with all the headline news on clinical staff shortage, burnout, resiliency, and of course, we can't forget the great resignation. My name is Walt Ellenberger, and I head up business development and strategic partners for all the healthcare interest in SAP's regulated industry. Today, I will be the meeting moderator. This session will be recorded and made available to all those that have registered for the event. You'll be on mute during the presentation, but will be able to submit questions. Let me introduce the speakers. So first up is Copilia Rose, who goes by Rosie. Rosie is the global lead for DXC Technology's Human Experience Management healthcare offering. Boy, that's a mouthful. Rosie has an extensive background working in the healthcare industry, including the pharmaceutical space and private and public sector provider organizations. Her operations, systems, and consulting experience placed her in a leadership role at DXC Technology, where she is pursuing her passion for addressing the next generation of human experience management solutions. Rosie will be co-presenting with her colleague, Paul Kenrick. Paul is the North America leader for DXC Technology's SAP Customer Experience practice. Paul is an experienced senior leader with over 18 years of consulting and operation experience in complicated, complex enterprise IT systems. Paul has extensive experience with SAP solutions as well and takes great pride in leveraging his business operation knowledge in implementing these applications to optimize business value. So with that, Rosie, I will turn the floor over to you.
Thank you so much, Walt, and it's great to be here. And hey, Paul, how are you?
I'm good, Rosie, and yourself?
Yeah, really good. So we might just kick off then, and I think I'm in control of the slides now. So I'm just going to kick off with this one that's really just outlining the fact that recent times, we're all very, very familiar with the recent times and the recent healthcare crisis, and it's really put a significant load on our workforce in the healthcare sector. And so that's something that here at DXC and working with SAP, we've started really looking at closely. And it's amplified what we found were historical issues anyway in the workforce management space in the healthcare context. So that means that it's not just a bit of a bubble with what's been happening over the last few years. There has historically been, and there's a little bit of a timeline on this slide, historically been an issue in the workforce management processes in our acute and aged and community care environments. So just moving through, this is where we've sort of captured some of these requirements so that you can see the sort of things we're talking about when we talk about workforce management in healthcare. And so, there's the recruitment and onboarding, bringing talent into the organisation, managing them while you have them in the organisation and retaining them. That's a really key thing at the moment. And then just ensuring that you're actually providing them with the development opportunities and the performance opportunities whilst they're in the organisation. So as we sort of just talk about that as workforce management, we've done quite a bit of research in recent times. We've been talking to customers. We've done a few other webinars where we've started looking at some thought leadership pieces. But we started really hearing there's a few key elements, and I'm just going to touch on those right now. So I mentioned staff shortages. That's something that's happening. Walt just mentioned the great resignation. So staff shortages we're seeing globally. We're seeing them everywhere. Employee retention, being able to keep those staff when you get them. Managing the processes that are supported by skills and competencies and best practices and alignment with standards and that type of thing, and then employee experience. And so these specific priorities are elements that we believe that technology can support. And that's why we wanted to take you through some elements today to just show you the solutions that we've developed and where technology can really support those, particularly those 4 items. And what we've got is we've got some personas that we want to talk to you about, and that actually includes the experience of an incoming candidate or someone coming into an organisation, a hiring manager or a line manager, and looking at those things around skills and competencies, etc. And then the employee themselves, the employee from an experience perspective and the employee from a development perspective. So, Paul, tell us about what you can, from a workforce management perspective, what the solutions that we have can offer.
Yeah, thanks, Rosie. So I think you touched on it a little bit here, in that the way that we've put our solution together here really sort of addresses the key things that we've been discussing with various experts in the industry, right? So we've spent a lot of time talking to people, and we've spent a lot of time listening to their issues and understanding the problems, and we're really sort of addressing it from both a back office perspective, being sort of the traditional, hire to retire type scenarios, which most organisations have as part of their technology landscape, and all the way through to the front office side of things, which is the employee experience. And then I guess from here, I'd like to jump into a quick demo if you'd give me some time and take people through some of the things that we've delivered and some of the things that we've built out.
Excellent. That's great, Paul.
Starting with an external candidate who is looking to apply for a particular role. They're already a nurse in the industry and are looking to progress their career. You can see here that they've come onto the Fierce Healthcare website, and the website here looks like any other sort of normal website. The key difference here is that whilst for all intents and purposes it looks like it's a website, this particular content and this particular page is actually being served up through our solution, and is used both internally and externally to sort of centralize the job creation and the job hiring process. So if I have a quick look here down the page, you can see at the top there's corporate branding. As with any of these, website type pages, the corporate branding is completely configurable to what it needs to be. But again, you don't need a web developer or anybody like that to make these changes. It's all done based on templates within the system. You can see here we've got a little bit of information about Washington, DC with a YouTube video that's been embedded into the page. And there's multiple ways to search for a job. There's a talent community that we've got, and there's also another way to search for locations down here. You can see here that based on my geo coordinates, it's picked up that there's a job in Washington DC. It drops a pin there that says there's one job. If I clicked on that job, it gives me an overview of the job description, a registered nurse. Equally at the same time, if I wanted to go over here and talk about searching by a keyword, I'm obviously interested in applying for a registered nurse position. So I'm going to type that into the checkbox here, or to the search box, I should say. And then I search jobs, and it'll bring up a listing of everything that matches that particular job. I can see here that Fierce Healthcare has two different roles, one in Washington, DC, and one for a registered nurse in Los Angeles, California, the dates that they were posted. And then by clicking on that particular hyperlink, it takes me to an overview of the role itself. See the date that it was posted. It's a reasonably new role, so that's good for myself. The location is good for Washington, DC. The company would be branded according to the same as the healthcare provider or the company at the top of the page. And then it goes through basic job information. So a description that says, what is the job role? What is the summary of the types of things that you would have to do? And then I guess the core competencies, skills, and education that's relevant for that particular position as well. The key thing to note here, as I said previously, is that, whereas traditionally a lot of organizations have corporate websites where they have to post jobs on their website and then do a separate process to then create the job internally, this is all centrally located, and served up both internally and externally, which we'll cover off in a little bit of a time here. So obviously I've reviewed the job description here. I think it's a good fit for my skills. I'd like to go through an application process now, and then, typically you would click on the Apply Now button, at which point, it'll either ask you to log in or go through a particular position. You can see here that it's asking me to sign in. I'll sign in there, and it should take me to the application process. or it'll probably give me a message here that says I've already applied for that particular role. And the reason for that is obviously, in purposes of the presentation today, I've already applied for this particular role. But as you can imagine, an application process is fairly straightforward, whereby you provide, your resume, covering letters, a summary of your experience, and then all that then gets transferred to our recruitment and onboarding part of the solution, which we'll cover off in the next presentation here. So now we're going to jump over to the role of the hiring manager within this process. We've just seen how an external candidate could apply for the job through the Fierce Healthcare external site. Now we're going to come over here and have a look at Martin Wayne, who is the hiring manager as part of this process. You can see when Martin comes in, his homepage is presented, with a bunch of different information that is, configurable to suit the needs of Martin as a person, but equally, as the organisation as a whole. So the first thing he wants to go and do is have a look at all of the candidates that have applied for the position, and he does that by clicking into the recruitment module within our solution here. So you can see here it's got the job requisition that we saw externally there for a moment, which was the registered nurse. We'll come back to that in a moment just to show you what we talked about previously, where we create the job profile and we use that both internally and externally. You can see here that he's the hiring manager. Ideally when that's due to be finished. So they're hoping to get somebody on board by March 20th. And you can see that the progress at this point in time, a little while after the process has started, is reasonably slow. And that'll become a little bit more relevant when we go into the next screen here. And we can see that the last update here was, only a day ago. So, from in terms of an overall process, he's got a very quick snapshot in terms of how that particular position, or equally any positions that he was responsible for within the organisation, were progressing. So you can see here very quickly that you've got 3 candidates that have applied to the role. And if we want to go and have a look a little bit more around those candidates, we simply click on the hyperlink here and we're taken into, the next part of the solution, which is what we call the talent pipeline here in a moment. So you can see here very quickly, it's got a lot of information on the screen. All of this information here is, can really be customized and configured to suit these. Across the top here, you'll see a ribbon. This ribbon really just talks about the configured process for recruitment within, any organization. We can see here that, we've got one new applicant, one person's progressed to phone screening. We haven't shortlisted anybody and we haven't interviewed anyone. And as we move each of these applicants through to the different phases of the process, we can filter out the information by clicking on any of these particular ones, right? These particular chevrons at the top here. So you can see that Sandra's progressing quite well. She's already gone through a phone screening, and Mary J. Blige here is the new applicant that was done, that has come through since the last update. If I wanted to go and have a look at Mary J's profile, I could click on her particular profile, which gives me the information that she supplied when she applied for the job. You can see very quickly here that, we've got all the information here relating to things. She's, if there's any particular documents and general questions which she would have gone through as part of the application process. If we go back to the new application screen here for a moment, I just wanted to talk very quickly here about the job requisition and the job requisition details. I think you'll recall earlier on in the demonstration, we talked about the fact that, we create the job requisition information within the system and we serve that out both internally and externally. So if I go to the job profile here for a moment, you'll be able to see here what I was talking about within the system here, where we create the information. So you can see here that the job profile that's been created here is exactly the same that you saw on the external website. And how we do that is obviously we create that in the system here, and then we serve that externally through the career site, through connectors within our particular application here or within our particular solution. And the last thing I just wanted to cover off as this part of the demonstration here is to be able to say, okay, let's have a look at the job postings, because obviously job postings can go both internally and externally. And we can use the same information or the same job profile as part of that job requisition to be both served internally to an internal career site here, and then obviously an external site, which we talked about previously. So you can see here that we can set, when the posting expires, so that if that job's no longer valid or we want to take it off the career site, we can do so fairly easily by setting the posting expiry date here, which is the message here at the bottom. But in terms of the overall process, we go back to the candidates. Again, as I said, we would go through a process by which we move those candidates through the recruitment cycle. And once we'd made a decision to hire them, obviously we would do the onboarding process within our organisation. So just to quickly recap on what you've seen so far in the demonstration before we move on to the next persona and the next scenario is we started with an external candidate coming into the organisation and applying for a role through an external job board. We talked a little bit about how we would create that centrally and use that job profile to drive both the application and recruitment process. So the next scenario I just want to cover off in relation to our solution here is just how we would then go and I guess performance manage or set goals and development goals for existing people. And one of the key terms we heard from the experts within this industry throughout our many discussions with them when we were putting this solution together, is how do we get the best out of our people, and how do we grow both our internal people from an inside up perspective and also attracting external people from an outside in perspective. So the next scenario I just wanted to cover here was a scenario whereby Martin Wayne is the persona that we've been using to date, is the the hiring manager for the external person, and also I guess the head of the department. It's coming to performance review time, and Martin's got a number of different employees that are reporting to him. And one of the key things that we keep hearing about, which are critical to these types of systems, is that the biggest rates of burnout in organisations and the greatest drain of talent is fundamentally leaders and supervisors, and that's because they have many people to look after. They're trying to deal with multiple groups within their department. They're also trying to make sure that they've got their employees are engaged in the wellness and development of their own internal stakeholders and also their internal employees. And then also from a performance management perspective, wanting to make sure that on occasion, when it comes time to doing performance management and handling that process, the process is as quick and as easy as possible, mainly due to the fact that, on occasion they could have hundreds of performance appraisals that they're trying to get in just to make sure that, they're staying on top of their team. So the scenario we'll go through now is what we would call goal setting within the organization, and show how easy it is for Martin to set goals, based on different people within the organization. So again, here we are at the home page. You can see up the top right, we're still in the context of Martin Wayne here for the purposes of this. And we're going to go through the goal setting process now at the moment. So we navigate to the goal process by selecting goals from the drop down at the top of the screen there. And you can see here that we've already got some goals in there that we've previously created, and they've been linked to what we call as a goal plan. Now, these goal plans, you can have one or many goal plans. You can see that we've got certain other ones here for other demonstrations that we've done. And really the aim of the goal plan is to be able to create that goal plan and cascade the goals down to employees with really a single process. Rather than having to go and create goals multiple times, we want to create a goal plan and then essentially cascade that goal plan, or ultimately that particular goal, down to people within our organization. So we can see here we've got different categories of goals. We've got service goals, we've got some people goals, and we've also got some quality and safety goals. And these would be typically goals that are applied to people within Martin's department. You can see here that we've got both public and private. Public meaning that they're visible to everyone, and private meaning only people that are assigned to this goal plan are able to see those particular goals. So for the purposes of the demo, what we'll do is we'll just go and create a quick goal here, and we'll make it very generic. And we're going to create a new goal ourselves, and we're going to make this and add this to particular goal plan, and we're going to make it a personal goal. We can see that we're going to make it for quality and safety, and the goal name is going to be ensure that equipment is fully functioning we can put a metric in there that would said, equipment doesn't fail. You can see we've got some inbuilt spell checkers here, which is obviously important always when we're making sure that we're trying to set goals. We can add a weight to that goal that says, of their overall performance, what does this goal make up? We're going to make this one 25%. We're going to start it on the 1st of January. We're going to complete it on by the 31st of December, because their performance period runs from the beginning of the year to the end of the year. But obviously, each of those start dates and end dates are completely up to the individual and up to the user. If we wanted to, we could add some milestones. We could add some sub goals in here, but for the purposes of this, we're not going to do that. So we'll save the changes there. And we'll see that show up in the goal plan, which is like the template for how we set all of the goals for our organization. And again, remembering that we can have different goal plans based on the different skills or competencies or different roles within Martin's department. If we come down here to the bottom, we can see here that there's the goal that we've just added into the goal plan. It's a private goal. And now what I want to be able to do is Martin wants to be able to say, okay, so everybody that's just applicable to this goal plan, I want to cascade this one particular goal down to, certain people within my organizations. And I can do that very quickly by just coming up here and clicking the cascade button. Obviously choosing which particular person I wanted to do. For the purpose of this, I'm going to send it to Carla, and then I'm going to cascade it down to her. And you can see that you get a message that says it's been done successfully. If we scroll down here very quickly, once the screen refreshes, you'll be able to see very quickly, like you do with all the other goals, how it was aligned and who it was cascaded down to. So if you can come down here, you can see that the equipment is fully functioning at all times. You can see that it was aligned down to Carla. And then if we were to log into Carla's particular profile, we would be able to see that goal that Martin's created for her. So really what you've just seen here is that Martin's setting himself up now, or setting his department up for how they're going to manage their performance appraisals or their review of performance and competencies and skills over the course of the last 12 months. He's created his goal plan, and now he's just pushing that goal plan or specific goals out to people. The next part of the equation that we'll see, or the next part of the scenario we should see, is how a person within Martin's department then obviously would go through and measure themselves in terms of their performance against the goals and development plans that Martin set for those people. And that'll be the next part of the demonstration that we'll cover here in just a moment. Okay, so the next part of the process we look at is after the goals and development items have been set by the department manager or the line manager, or in this case, the head of the department, Martin Wayne. We're now going to switch over here to, I guess, from an employee perspective, how they would then go and measure their performance against each of those goals that were set for them. As part of this process, we're going to have a look at a little bit about how each of the goals and development plans have been automatically cascaded down, so that the person in this scenario, Mark Clinton, who is the employee, can then see and measure his performance based on his own perspective against each one of those particular items. So you can see here when Mark comes into the system, he's got a homepage that looks a little bit different to the one that Martin had, obviously because he's not at the same level as Martin, and Martin has slightly more things that he can see and do on his dashboard. But the key thing here is that he's got a to-do item that says he needs to go through and perform his performance appraisal or review his performance appraisal. So if we select that particular tile, I click on the employee self-assessment. And this is the process by which Mark then goes through and measures himself against each of those items that have been set for him. And also review performance against any of his own personal development goals or specific things that he might want to use in terms of his overall performance throughout the course of the year. So the very first thing we can see is that we've got some information here about Mark. We've got the process by which the self-assessment follows. It's a 4-step process in this particular scenario. Again, this is configurable according to the needs of each organisation. But it's a fairly linear process that, anybody who sat through a performance appraisal or a end of year performance management activity can probably be quite familiar with. So the first thing we'll see here is the goal plan, which we talked about. So these are the goals that were set for Mark in this scenario by his manager, Martin. And you can see then again, the same categories and the same goals that we set in that goal plan have come through automatically into Mark's role readiness assessment or performance appraisal. Quality, safety, and then fairly straightforward. He obviously goes and gives himself a rating for each of those things. Each of those items, he can add some free text if he likes, if he wants to go through and see the goal details about what the specific metric is. And then over here, he obviously marks himself either on track, behind, or not started within each of those things. So if I wanted to go and update that very quickly, I could show you how I could edit that goal and say, yeah, okay, I understood all of those things. I'm going to say that I'm completed this one. I'm going to save the changes, and then I could go through and give myself a rating that says I feel like I've met the expectations of this particular goal that was set for me by my manager. That'll just refresh there for a moment when the screen comes back up. Now we want to go through and have a look at the specific competencies that are assigned to the role. So obviously Mark fills the position here. If you have a look, he fills the particular position of a nursing assistant in the organisation. And we want to go through and have a look at the specific competencies that Mark and his employee and as a position of nursing assistant within the organisation, must make sure that he's competent in, right? So we can go through the role specific competencies. If I just collapse all of those very quickly, again, we're going through three parts of Mark's readiness assessment. We've gone through his goals, the specific competencies with the role. Each of those competencies, the same as the last one, gets a rating by Mark, and then obviously an official rating, which is set by his manager. Typically, there'd be some kind of performance review or internal discussion that would go on. And then what the system automatically does once we get a rating between what Mark says and what the official rating comes back as, it can tell you whether Mark's overachieving, underachieving, or right on point for each of these things. And that obviously helps, each of the people in the process, both Mark and his manager, make sure that they're focusing on those areas that Mark might need to further develop, or things that he could do better, or things that he's doing really good at, right? Or really well at, I should say. So the last part of the assessment for Mark is a development plan. And a development plan obviously is typically either set in collaboration with a manager, or if Mark himself feels like he wants to be able to go and put a development plan for himself in so that he could aim to use that development for a particular or future position that he might want within the organisation. So perhaps he wants to be promoted to a nurse practitioner or a registered nurse practitioner. He can go through and add himself a development plan. We can get some development goals if there was particular learning activities that we wanted to say we needed to do. Again, specific details about the goal itself. So this development plan has a goal that's a development goal, which is different to goals for within the role. And this is all aimed at making sure that both Mark and the organisation are best managing Mark's competencies, making sure that he understands that there's a future career path there, and really just making sure that everybody is on the same page in terms of how we progress through the organisation, where we're doing well, and what other areas people might like to work on. So the last part of the demonstration, which we're going to cover off in the moment, is succession planning, where we're going to take Mark from his current position, use all of the information that we've seen already in terms of his goals, his competencies, the development items, and all of the things, and see whether or not he's ready for succession, and how Mark's manager, Martin, might be able to go through and look for successors for a particular role based on their competencies and based on their performance, and how that process is quite easy to manage within the system. So there's just one more part of the demonstration that I'd like to take you through today, and that's sort of dealing with a term that we hear a little bit throughout the course of our discussions with people, which is, promoting people from within, or the inside up discussion that says, how do we plan for, succession of people within our organization? How do we support them, and how do we help mentor them so that they can get growth within their current role and also their future aspirations? And one of the ways that we do this in our solution is to come through what we talk about here, which is succession planning. So if I see here very quickly, I'm in Martin Wayne again. Martin's one of those people that we've seen throughout the course of the demonstration. And the scenario here is that Mark's looking for people from within the organisation that he'd like to be able to promote from within. So that inside up promotion that says, we're taking people within the organisation and moving them into, future roles or career growth. So the way that we do that is we come over here to the succession part of the solution. The succession part of the solution allows Martin to have a look across his department as the head of the department on, all of those people, both direct and indirect reports, who might be right for, future roles within the organisation. So that kind of career planning, succession planning part of, the hiring process and talent management process. So you can see here, we're looking at the succession org chart. You can see Martin's the head of the department. He has 3 people that report directly to him, and he currently has 1 open position within the organisation. So perhaps he's looking to promote somebody to within that open position, and he wants to see, who else might be available to promote from within. And you can see here that he's going to go to Samantha Brown. She's got 1 direct report and 2 total reports. And you can see here that John Coles is a person that might be suitable for this particular role here. But equally, what we're looking at is if we were to promote John Coles into this role, we were going to take Mark Clinton and potentially promote him to within John Coles's role. So the scenario here is we're going to have a look at Mark's performance and Mark's history within the organisation. I just want to see how ready he is for that particular role. So by selecting the overview of Mark, you can see that he's added as a successor. The bench strength says that it's ready now. So we want to maybe go and have a look at, his development plans or the things that we've discussed with him as part of his employment within the organisation. So I do that by, again, just selecting Mark's image there, and I can see general information about him. You can see who the incumbent is, and we're saying, hey, guess what, that potentially we might want to promote Mark to the next level up, which will be a licensed practical nurse. So I want to, as Martin wants to go and have a look at some of the information that he's got here, we're going through, his development plan that says, what have we spoken to Mark about previously to help him on his journey to be promoted within the organisation. So we're going to have a quick look here at Mark's overview. And you can see here very familiar sort of information. You've seen the development plan before. You can see again the development goals that we've set. What are the competencies within those goals that are addressed by these particular competencies? You can see here that I'm looking at Mark Clinton, but within the context of Martin, we can scroll down and see all of the things that we've created previously, and that really goes to the point about this being a centralised approach to handle all of the external hiring and internal development activities within the organisation. The last little thing I'm just going to show you here is the career worksheet. Again, the career worksheet is a way of, Martin as the manager, just to have a look at, some of the competencies that it needed to be done for Mark Clinton. So I'm just going to type Mark Clinton's name in here again quickly. And this basically shows, what are the positions or what are the roles that are suitable for Mark Clinton within the organisation, and whether or not the system determines he's ready for the roles that he's considering. So you can see here that Mark Clinton himself is looking for a licensed practical nurse, and based on his competencies down here, we can see that he's not quite ready yet. But the reason for that is that he's got a number of development goals in his development plan that he hasn't quite fulfilled. You can see here that he's got some of them, but not all of them are completed here. That means that in terms of him, he's on track with this particular one, but he hasn't completed all of his development goals. So the decision would need to be made as to whether or not we promoted Mark at this stage, or we decided to allow him to do a little bit more development within his career. So that's really the last part of the demonstration that I wanted to take you through today. I hope you've got some benefit out of what we've demonstrated here today. I think Rosie's got a little bit more of our solution that she'd like to demonstrate. So at this point in time, thank thank you all for watching and listening, and I'll hand over Rosie to take you through the last part of the demonstration. Rosie, over to you.
Awesome, Paul. Thanks for showing us that. So that's actually really captured the essence of probably what we call the first 4 modules of our DXC Workforce Suite for healthcare. So this image here is really just showing that there's 8 modules in the solution, and we're going to talk through a couple of those as we move through this webinar. But you've really captured those 4. And the 4 purple ones. So I think you've probably touched on looking at those: performance, and definitely development, and then that recruitment onboarding area of commencement. So in doing that, I think it's really key to know why workforce management in the way that you've shown is really valuable to the organisation. And I think this is sort of sums it up a little bit, that there are some long-term benefits of some of the content and the functionality that you've just shown us. So it's about, of course, being able to cope with it happening again, it being any peak in service demand, peak in demand in the health sector, and stress on the workforce. So being able to cope by understanding what skills and competencies you have in the workforce, where they're assigned, what gaps you have, and how you can support the workforce. It's around service quality. You can see some of the things there that really talk to workforce management, particularly the areas of reward and recognition and ongoing education, etc. So improving the service quality. And then those that are working in the healthcare sector will understand this move from the triple aim, to the quadruple aim. So that is really the ability to improve the health of the population, to improve the patient experience and reduce costs. You actually need to look after the care team. So care team wellbeing is an imperative. And in doing that and looking after those care team members, you're actually building a resilient workforce. And if you can build resilient individuals in an organisation, by default, you're actually building a resilience in your organisation. So those are the really key workforce management areas that those elements that you showed, Paul, actually do support. And then the other one I want to talk about, so we saw this slide before with these areas of workforce management, but I want to talk about this one in particular. So this one, protecting and supporting the workforce. So that's one of the other modules, there's a couple of the other modules actually, that we started looking at how can we support the workforce better, and that is because of the level of stress, the stress in the organisation. And so what I want to do is just show you a bit of a timeline of stress in the health sector. Now, we all know what's been going on for the last few years, but when I sort of started digging into some research, I can see that stress was already an issue for healthcare prior to the pandemic. So we can see there's articles here that suggest that this was already a problem. It's by nature of the industry, it's very often a stressful field to work in. Then as we moved into the pandemic, we started to see some really high numbers, 93% of folks being stressed, etc. And then really when we got into 21 and some actual primary research had been undertaken, you can see again that the risk around healthcare workers had increased significantly, particularly in the area of mental health. So what can we do about this, and what have we done with these other modules? And I want to just take you through one of the items that we have that actually really is to start looking into the organisation level of stress, and that's one of our survey tools. So here you can see on the screen of my mobile, so this is my mobile and I'm just sharing the screen, and you can see here this is our experience management product. What we've opened is the DXC Workforce Suite for Healthcare Employee Experience Survey, which is actually a survey that we developed with healthcare professionals around some specific question sets relevant to the healthcare provider organisation, and particularly with regards to stress and burnout, safety and protection, and culture and change. So I'm going to just click through this one and just show you a little bit of how user-friendly this is. But I wanted to point out that this tool is very user-friendly, and this tool also comes with a lot of content available to organisations for healthcare, with patient experience and other operational experience data capture as well. But this particular survey has been developed. There's over 100 questions in the library. It's developed specifically for this industry, specifically during times of stress. And what we're looking at here is the ability to choose from that library of questions and put some relevant surveys together. So I'm just going to fill this in. It's very user-friendly. And I'm just going to say, well, no, that's a peer support. Just showing you some of the different ways that you can interact with the survey. Excellent communication, yes. Technology is, no, it doesn't matter to me. And initial training, well, yeah, I'm fine with that. Training, that's fine. Am I feeling safe? Probably not. Why do I need to raise a concern? Well, you can actually insert a hyperlink. You can configure this to however best for your organisation to use this. So we could actually link that to a HR ticketing system or a risk incident management system, depending on what you were wanting to achieve from finding out about that particular information. This one here is around safe working conditions. Yeah, we're okay there. Personal protective equipment, maybe not. Again, I could raise that. I've shown you how that works, so I'll say no there. Have I been trained? Probably yes. But is my organisation working to protect us? I would say yes in that instance. But here we start looking at some of these stress ones, and I'm going to point these out here because I'm going to touch on the some of the results in a moment. So if I say, am I feeling overwhelmed? I'll say probably yes. Do I know why? Well, I would suggest right now it's my workload. That's quite simple. One word's fine there. Do I feel more stressed than normal? Absolutely. Do I want access to employee assistance? Actually, didn't occur to me. Yes, let's jump in there. And so I've just put one in here just to show you how easily that could open. I could then go here and access that. Now it's just a sample one that I found online. But then I can go back to the survey if I need to, because now I've made an appointment with employee assistance. Oh yes, finish this. So am I feeling yes? Oh no, I've already done that today. And I'll say yes, and again, don't need those details. And this one here is really just about what am I doing to support myself here, and it might be, you know, attending groups or something, and submit. So it's actually that simple to fill in the survey. So I think from that you can see that it's easy enough to capture the data, and that's probably very important that it's a user-friendly interface in that way. But one of the really key things, of course, is what that data can do for you. And just from that particular tool, so that survey tool, we can get some really good reports out, and this is one of the particular questions that I showed you there, around feeling stressed and are you feeling overwhelmed. Now, we know that our workforce is feeling this at the moment, but this is actually giving us the ability to quantitatively capture that. And we've got customers using this survey as a proof of concept to actually fuel business cases in trying to get more employee wellness activity in their organisation, so more tools and more programs, etc. So being able to quantify it. So that's just the answer to one question. Now we can break down those answers by role, by division, as that one is there, and any of the demographic metrics in the actual survey itself. We can actually start looking into each particular question. We also had some questions in the proof of concept survey that we've been socialising, which actually are based on the Oldenburg burnout inventory measures, which are academic measures of burnout, and this can be of an individual or of the average of a particular organisation or team. And there's just some gauges that you can see there based on those questions. Just to show that you can start getting an indication through surveying the organisation and really start seeing whether or not there are some areas where additional support is actually required. And so just moving into to see where that fits into the picture. So the one I've just showed you there, our survey tool or our engagement tool, employee experience tool, is that number 6, the blue one there on the diagram. So in that theme of data and capturing data, I wanted to also show you some of the content that we have in our module 7, which is our analytics module. And so what that is doing is it's bringing the data from those workforce management modules and combining it with the sentiment data from the survey tool. So from a solution perspective, I won't log into this one and do a live demo. I just grabbed some screenshots from activity we've been working on just to show you. So this one here is a dashboard. It's really showing some employee-initiated feedback that may be captured throughout a shift or throughout a 24-hour period, just to show that there's some reported levels of stress, folks that are reporting how safe they're feeling, and there's also on that one 2 indicators around personal protective equipment. So that was one we've set up already. So there are some pre-configured dashboards in our analytics module. This one here shows that you can see from a geographical perspective where the data is coming in from. That's a global view. It's a fairly macro view. You can actually see that on a more micro level as well. So you would be able to see whether or not there were indicators of stress or indicators of not feeling safe in a particular area. Sort of the red and the amber ones are the ones to really start looking for and being concerned about. This one is really looking at some trend analysis around stress at work. So this particular view is at point in time. You can see that there's been some historical stress graph there, but it is also doing some predictions. So based on the history, there is some predictive analytics in there to suggest what the stress may look like if it wasn't attended to. And then the very last one here, which is my favourite at the moment, this is one of the stories that is actually really looking at the correlation between some of the data of the different solutions. So you've got the workforce management content that Paul was showing, bringing that in and combining it with the sentiment data to see whether or not there is some correlation and maybe some causation in some of these things. Now, we understand that there are a lot of factors inputting or impacting stress levels in the organisation, but what we've been able to do is look and see whether or not there's if the competency gap or folks not feeling competent or not having achieved competency in various elements of their role or their job profile, as Paul was showing, if that is actually connected to stress, and if we can see any relationship there, that if we can get the competency of the resources up, then maybe the stress level can come down. So that's really our Module 7, our analytics tool, and it's exciting to see some of this data coming through. And so if we keep that in mind, it brings us back to this particular item of protecting and supporting the workforce, and how can we do that? So measuring it is one thing, understanding the level of stress and burnout is one thing, but what can we do about it? So again, sort of jumping into some research, we had a look and thought, well, what is very relevant to this sector? We also did some ideation and design thinking with the nurses, doctors, and mental health professionals. And we found that one thing came through, even from the design thinking work, but there's also academic literature to support it, and that is peer support. Peer support and connection are vital elements in helping people to reduce stress and reduce burnout. And so the research actually really talks about that, not just peer support, but the provision of wellbeing resources to the team as well. And so we took this to another level, and through that design thinking and ideation, we actually developed an application called Safe Space. We're going back to my phone again. What we've developed is an app called Safe Space. I won't log in as a guest today because it's only got limited functionality for guests, but there is some access to information and care in the app for guests, because we wouldn't want anyone to not have access to support resources. But essentially what we do is we sign up as a user. So there are terms and conditions and various privacy requirements when you sign up, but one of the key things that we'd like to point out here is you can actually sign in as and I need to put my face there, sorry. You can actually sign in as a pseudonym or an alias. So mine is Roses Are Red, and that allows you to use the app anonymously or in an anonymous context. That is something that came out of the ideation and design thinking sessions that we held with our nurses, doctors and mental health professionals while we were developing this app, is that they wouldn't necessarily want to identify to peers or supervisors that they weren't managing so well, but they still really longed for the ability to access connection with others, peer support and information and other resources. So what we've done is we have created it in the anonymous context. So we'll just go from the top to the bottom, just to go through some of the features of this particular app. So here we have some additional tips and they actually go through to various web sites that open up. The Better Health channel, for example, these ones are breathing. We've got some mindfulness for stress relief and that type of thing. And there are other tips like that in the solution. Then we move to connect with others. So this was the primary premise of the application. What was the peer support and connection, as the research was pointing to. So this is a test environment. You will see some test data in here, and you'll notice that I haven't been in here very frequently in this particular version of the test environment, but we'll go through and we'll see what I can show you. So the first thing here is the connect with others. So connect around communities. It's groups of like-minded people that may develop a group and others can join it, or you can actually create a group yourself. So if I have a look at my groups, here are some groups that I have joined since using the app. And one of them, for example, is, dog owners or dog lovers. And you'll see that there's various conversations here. So, does anyone notice that your dog can tell when you're stressed out? And there's some conversation under here. And again, it is test data, but you can actually reply and you can say me too, or you can engage with folks in that regard. So I'm just showing you very, very simply, but of course you can actually have meaningful conversations in groups of people with like interests. So we'll just go back to the page before. So that was the group for dog owners. You can actually have several topics under here, so you can actually add a topic underneath. So there's not just the pets for stress management, there can be other topics under here. Very commonly used functionality, as you would see on various forums or other web domains. We've replicated that type of functionality here, but again, the key is being able to use it in the anonymous context. So again, if I'm looking at my groups and I'm talking to this new group, and here is someone that is testing, so I may actually direct message this person and talk to them about something I would like to talk to them about that I saw in the group. They may have noticed something and reported on it. They may be talking about some helpful tips. They may have some suggestions that you liked, and you can actually message that person directly in the direct messaging app. So you can jump directly to the direct messaging app using this envelope at the bottom here, and you can see these are direct messages with resources in the solution. And the way to meet those resources or those people is through the communities. So the communities is where folks meet each other. You can't just jump in and start messaging someone without meeting them through a community. So there has been some thought through this and how to connect with others. So it really is around finding people of like mind and like interests and talking to them about, doesn't have to be about stress, sharing recipes, doing whatever you may wish to do. And this is across domains as well. So the use case that we talk about and the reason this was developed was nurses in Italy and nurses in New York. Had they been able to talk at the onset of the pandemic, they would have been able to have a level of connection, and the nurses in New York would have been able to say, well, is it as bad as we're seeing in the news? Is it, how are you managing? What's going on? And just be able to support each other in that way. So it is across various healthcare providers. So if your organisation signs up for Safe Space, you would actually have the ability to connect with others in groups like yourself in other organisations, and that way it sort of spreads that support network and provides that peer support domain for resources of like kind. And it may be that there are different groups that you are a member of, and you only really connect in those groups when you're under peak stress. So this app isn't necessarily designed to be used on a daily basis. It was really designed for times of stress or peak demand, and just the ability to just debrief a little bit and unwind. So I've touched on the connect with others. We'll talk about express your feelings now. So this is actually based on the principle of the psychological principle around journaling and identifying your own emotions. So that actually suggests that if you can identify how you're feeling, and if you actually can say a few words about it, you are actually processing some of that emotion. And so it is a personal use support tool. This is, no one can see this data. This is absolutely only for the user, this section. So expressing your feelings. So we're just going to jump in here to track your mood. And so we can just swipe through and see that we've got some darker moods being the purple ones. And as we move through the blue ones, I'm just swiping here on the screen, we move through to some green ones that are a little more positive, and then some fairly bright and happy lighter coloured moods. We can also see that here on this chart view, or grid view, I think they call it. So you can see the different emotions here. Again, the darker ones moving through the blue ones, and then green through orange and yellow. And those colours are important because I'll show you what they look like on a calendar. So here we can look at, let's track today that I might be awkward. It's an unusual emotion to track, but let's track as awkward today, and I'll say next. And so then it's asking, you know, how are you describing awkward today? Which is, again, it's identifying, how am I actually feeling? What am I doing here? How am I feeling? And so awkward, I'm actually feeling a bit uncomfortable, maybe a bit flustered, but no, horrified's a bit strong, remorseful. These words are all connected through an emotional wheel, an academic emotional wheel that we were using as the basis for the development. So there is actual I guess some science behind how these words were selected and how they come up. And then actually doing something around journaling. So I'd like to journal my thoughts for the day. Feeling flustered and uncomfortable and feeling awkward. I think I really don't like the roster that's come out today. I really don't like it. I think that's really what's going on. So I'm acknowledging that to myself at the moment. And again, this is personal, private, but I'm actually just looking at how I feel about this, and I've identified what it is I'm actually feeling like that about. And so then here we go. Here's our tracking as awkward. You can see earlier today, I tracked as relaxed. Now, and if there was others today, you would see them on this screen, and you'd be able to scroll up and down this screen and see how I was tracking today. So then if I finish here, it shows me that I was tracking relaxed earlier, so you can see the difference between the blue and the green. And I think if we go back and sort of look back in February, you can see I haven't used the test environment very often, but you can see back in February I actually tracked as anxious. That was the last time I used this, probably the last time I did a demo. So that is how we track our emotion. Now with that, you can actually schedule when you would like to be prompted to track. So you can go in and track it yourself, or you can actually be prompted and it will send you an alert, did you want to track your emotion? I think because it's designed to be used during peak times of stress, people will actually take themselves to the solution to actually track it. But if it's a really stressful time and you do want to be able to look back on this history and see all of your blue or green or orange dots and see how you're going, or track the purple that have gradually got to blue, gradually got to green, and then got through to yellow, then you may actually want to schedule that to ask you how often you'd like to track. Profile and history, that's just where I jumped into that screen there, and you can go back, and you can go back more than, I think there, if we go back last year, you'll find it. Yes, there was some last year as well. I did do some test data last year in this particular environment. Okay, so let's see what else we've got. We'll just jump home here. Now, access information and care. This one here is governed by the organisation that subscribes to this for their employees. So the connecting with others is the ability to connect with others from other organisations. Expressing your feelings is a very personal use support activity. No one sees that. This one here, access information and care, is actually information provided by your organisation or your employer. So let's just jump in here. So the first thing that we have is a link to an organisation's employee assistance. Now, we saw that in the demo I did with the survey tool. So this one here actually connects to a different one. This one actually connects to DXC's employee assistance page, and I would have to log in there. And it's quite clear that I'm leaving the personal use support tool and going into my work domain there. But we won't go into DXC's employee assistance program, but that just shows you that you can access it, you can connect it there. So that would be defined by the organisation, the employers or the employer organisation. Employee feedback. Now here you can actually, this one's programmed to go through to the employee experience survey. Now here's something we've all seen today. I think this is probably a different survey yet to the one I opened previously with the fierce on it, but you can see that we can actually connect through to a survey if we want to for employee feedback. Or it can be an employee-driven survey, so something that they can, as I mentioned, the one that they can scan the QR code at lunchtime. This one may be one that is an employer-instigated survey to provide feedback. You could also connect that to any other ability to provide feedback to the organisation. It might be a web form, or it might be something that you use, or a solution that you use. So that is flexible and configurable for the organisation that is subscribing to this for their employees. And then general information. Now, I haven't got anything programmed here in general information at the moment, but that is, again, configurable for the organisation. So that may be something that has, when you click on general information, you would open and you would be able to see the various programs that your organisation offers, whether it's support groups, whether it's mindfulness training, whether it might be a yoga group. They're all provided by the organisation. So this particular section, this access information care and care section, is actually organisationally driven by your employer. So just going back to the home page there, the only other thing to show really is there's they're the tips, so you can get to that up the top here or down the bottom. There's the messaging, and this burger menu here is basically a larger menu of all of the same items. So connecting with others, go back, expressing your feelings, accessing information and care. You've got your tips and your messages, get help, various privacy clauses, etc. There is also the ability to escalate or report users and that type of thing. There's functionality in here around that, or of course to log out. So I think that probably covers off really what we've done here from a safe space perspective to really try and provide that staff wellness resource and provide peer support and connection to employees within an organisation. So on that note, we've pretty well been right around this circle. Of course, it's a whistle-stop tour of the DXC Workforce Suite for Healthcare using SAP solutions, but you've really got a bit of an insight now into what we've been working on and the objective that we've had of the holistic workforce management approach. And with that, I think I'll turn back over to Walt.
Very good. Well, first and foremost, thank you, Rosie and Paul, for showcasing this very important solution, sharing your insights as well. I've always told people at the start of the pandemic, this is going to be a 3-year clinical trial that we're all part of. And my feeling is that the mental well-being is going to be the long-lasting aspect of this that we need to manage from a human experience perspective. So this solution is just spot on from a need and a capability perspective. So thank you. Before we move into Q&A, I wanted to give a little bit of a shout out to our strategic partner, Intel, for sponsoring these thought leadership and innovation solution showcases. It's important as the industry changes. There were a lot of changes going on before that were typical healthcare revolution or evolutionary. Now with the pandemic, a lot of the vulnerabilities are going to make changes more revolutionary. Intel's Optane DC persistent memory and Xeon scalable processors are the advanced technologies that are embedded in our SAP solution platform that really provide the speed and agility, and most important, the adaptability to not only survive, but to thrive in a rapidly changing healthcare space. And now let's move on to the Q&A. The good news is we have a lot of great questions. So let me tee this up in order. First question is there a whole solution? Do you have to buy the whole solution, or can you purchase modules? Rosie, is that one you want to?
Yeah, thanks, Walt. It is actually modular, and we've done it that way on purpose. And the modules can be mixed and matched. And the reason for that is some organisations may already have functionality in some areas. If someone's already using the solution for recruitment and that's not something they need, well, then that's fine. They can still pick up some of the other modules around goals and performance or employee experience or safe space. We've done it that way on purpose, and the modules are actually designed as well for fast time to value, and you don't need to purchase a brand new HR system for this. Whilst DXC and SAP still do those things very well, now's not normally the time when these crisis fatigued organisations for big digital transformations. So we've made those modules really fast time to value, and they can select them based on what they need.
Oh, very good. So next question. What if things change? This is a dynamic environment. What if things change? Will this solution be able to handle a change in the organization?
Yeah, maybe I'll take that one, Walt, to give Rosie a chance to catch her breath here. Yeah, so it's a really good question, right? So I think part of the challenge that any organisation is facing today is being able to take information, digest that information, and then make actionable decisions on the back of that, right? I think the beauty of what we've been able to create by modularizing these things is that it's adaptable and changeable based on the needs of the organization. So if we think about employee experience or the pulse of the organization, it's never a one and done single process, right? It's something that we want to continually be evolving. We want to be checking in with our people daily and monthly, and putting measures and systems and support networks in place to be able to make sure that they've got at that moment in time everything that they need to make sure that they are, functioning as best that they can. So I think the adaptability of what we've been able to create with this solution is that as the organisations change, the needs of the employees change, and the information that we're capturing changes, then this solution is able to sort of roll with the punches and keep being reused multiple times over.
Very good. Thanks, Paul. So next question. I wouldn't want my manager to see what I put in the Safe Space app. How private is it?
So that one, I get that question a lot. So that one is definitely on the circle in the position of module 8 for a reason, because it's actually modules 1 to 7 that all the data can be seen in the analytics module, where module 8 safe space is offline. It isn't connected to a HR record. It doesn't have employer visibility at all. It doesn't report into the analytics. It's a personal use support tool with a lot of data encryption and privacy, which I can actually go through if someone's looking for that information specifically, but it's definitely offline. Think of it as an extension to employee assistance. Something that's private and just for yourself, as I mentioned in when I showed you through the system.
Perfect. what if my organization uses travel nurses as well as temporary staff?
I didn't. We've got that. We've had that question before, and I didn't actually address that in this particular webinar because we had limited time. But that is actually module 5. So I sort of skipped that working through, not thinking that we would get an agency nurses or a contract nurses question. But here we are. We have it. So yes, we do have functionality for that. We just didn't show it to you today. But by all means, get in touch, and we can run you through that content.
Very good. So this will be our final question. Does the survey capability monitor stress, just monitor stress, or can it report on other areas?
Another good question. I've had a couple of good questions today, which is always good. I think the flexibility of any kind of human experience management tool is being able to change the options and change the values of the survey or the questions that you ask. So at the moment, it can monitor stress, but really it comes down to how you design the questions, what you're trying to measure at any point in time, and that's all, really quite straightforward. It's a configurable solution. It's not necessarily anything that needs development or a heavy investment of technology. It's user driven and fairly easy to put together to adapt to whatever it is that the organisation might want to measure at any point in time.
And the workforce management solution also has some native reporting that can be really pretty cool as well. Things like lead time for recruiting and how long it's taken for something. So there's reporting in all of the products. Well,
very good. Okay, good people. Well, that's going to be a wrap. I'd like to thank you for attending today's session. I hope you found this valuable. I know I did. I'd like to thank Rosie and Paul for sharing the solution and the insight. A quick reminder, this recording will be made available within 24 hours using the audience link that was sent to you earlier. And once again, thank you. Please be safe and sound navigating the labyrinth of the world we live in today. It's something I don't think any of us would have predicted 2 or 3 years ago. And I want to give a special shout out to all the healthcare professionals on the front line. The sincere, good energy, and we certainly appreciate what you're doing. So thanks, everybody.